Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Dupilumab. Its brand name is Dupixent. Before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Dupilumab is a human monoclonal IgG4 antibody. It inhibits interleukin-4 and interleukin-13 cytokine-induced responses. This would include the release of pro-inflammatory cytokines, chemokines, and IgE. In terms of indications for use, Dupilumab can be used in moderate or severe asthma, particularly when there's an eosinophilic phenotype. And additionally, it can be used to treat atopic dermatitis in moderate and severe situations when the patient is not getting the therapeutic benefit that they need from topical agents, or they're unable to use these topical agents. Now, before somebody was to use Dupilumab, there is a contraindication, which would just be patients who have a hypersensitivity to Dupilumab or any other component of the product. As well, there's some precautions and warnings that the patient should be made aware of. The use of systemic, topical, or inhaled corticosteroids should not be stopped abruptly during initiation of therapy. This is because systemic withdrawal symptoms or unmasked conditions may occur. Serious systemic eosinophilia has occurred, and it may occur in patients who are using this medication to treat their asthma. Hypersensitivity reactions have been reported with the use of this medication, including urticaria, rash, serum sickness, or serum sickness-like reactions. Anaphylaxis has also been reported. Some patients have experienced conjunctivitis or keratitis. Use of Dupilumab is not indicated in patients who have acute asthma symptoms, or in patients with acute bronchospasms, as well as status asthmaticus. Finally, patients with asthma who are using this medication should not change or stop their asthma treatment unless consulting their physician. Once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use Dupilumab, they can expect to receive their dose subcutaneously. When treating moderate or severe asthma, usually 400 milligrams would be given as an initial dose, and then 200 milligrams would be given every other week. Alternatively, we could start with 600 milligrams and then give 300 milligrams every other week. For patients with oral corticosteroid dependent asthma, or patients who are treating their asthma and also have atopic dermatitis, they would usually start off on that 600 milligram dose with 300 milligrams every other week. When treating just atopic dermatitis alone, 600 milligrams would be used for the initial dose, but this 600 milligrams would be broken up into 2 different injections at different injection sites. And then 300 milligrams would be given every other week. Now, as with all medications, there are some side effects or adverse reactions that people may experience while using Dupilumab, so I'll go over some of those here now. Injection site reactions occur in 10 to 18% of patients. 2% report dental pain, and 3 to 4% report herpes simplex virus infection. Blepharitis happens in up to 5% of patients, and conjunctivitis seems to happen between 9 and 16%. Dry eyes can happen up to 2% of the time, and keratitis can happen in up to 4% of patients. Now, some more rare but serious side effects would be any disorder of the cardiovascular system, vasculitis, pneumonia, or a raise in the patient's eosinophil count. That's all we're going to talk about today with Dupilumab or Dupixent. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.